Hello friends, welcome. Today we'll be talking about breech delivery. Sometimes in exam you are asked about breech delivery if you are answering very well. So remember, if you are asked about breech delivery, you should remember the presenting diameter will be a bitrochanteric diameter of the femurs. So you will again hold the pelvis in the anatomical position as I have shown earlier in my previous videos. And then you will say that first there will be engagement. So for engagement, the bitrochanteric diameter will pass the pelvic brim. Then again the four things which I always tell: with good uterine contractions, average size baby, good amount of liquor and an adequate size pelvis, the descent is a continuous process. Then there will be an internal rotation such that the bitrochanteric diameter will come to the anteroposterior diameter. Okay, till here it is okay. There will not be any flexion. The flexion point is out. Now, instead of crowning, when we used to say the head has crowned, here we will tell the breech is climbing up the perineum. So when you find breech is climbing up the perineum, you shift the mother to the delivery table and ask the mother to come to the edge of the table. So when the breech has climbed up the perineum, bring the mother to the edge of the table and then you wait whether the buttocks are being easily delivered. If the buttocks are easily delivered, then it's okay. If it is not delivered, then you have to conduct the Pinard's maneuver. In Pinard's maneuver, you insert your one finger, index finger, by the side of the leg, by the thigh, you insert it. Go to the popliteal fossa and push it. When you push the popliteal fossa, the leg comes down and catch hold of the feet and bring it by the side of the baby and deliver one leg. Similarly, you go through the other thigh, push the popliteal fossa so that the leg gets flexed, and then by the side of the body, you can bring both the legs. So this is how you can deliver both the legs and the buttock. Now what happens? You bring the back anteriorly. Always try to bring anteriorly the baby and let the baby hang. Okay. So catch hold with a breech towel. With a towel, you can catch hold of the baby and let the baby come downwards. You can pull the baby. Why we catch hold of with the breech towel? This is because if there is undue stimulation of the cold environment on the baby, then the baby will start breathing. And in that case, there will be aspiration of amniotic fluid by the baby. So, cover it with the breech towel and let the baby come. Then comes the shoulders. If the shoulders get easily delivered, then well and good. If the shoulders do not get easily delivered, then you have to conduct Lofset's maneuver. So, in Lofset's maneuver, the idea is that the shoulder which is anteriorly stuck above the pubic symphysis, if it is gone posteriorly, then it will get easily delivered because posteriorly there is space in the pelvis. So what you do is you rotate the baby such that the anterior shoulder goes posteriorly and it comes down, and then again you rotate in the opposite direction so that the posterior shoulder gets delivered. Okay, so this is how you deliver by Lofset's method. After both the hands have been delivered, now let the baby hang. So this is why we have brought the mother to the edge of the table. By its own weight, it will hang so that it will facilitate the flexion of the head. So when the nape of the neck is visible, you can do either of the three maneuvers. First, you can do Burn-Marshall method. In Burn-Marshall method, you catch hold of the feet of the baby and give with the long traction, long arc of a traction. You just let the baby feet come to the abdomen of the mother and then you will find the baby has been delivered. The second is the modified Mauritius-Mealy weight technique, MSV technique. So MSV is done when the nape of the neck is not visible. Okay. So from the time the umbilicus has been delivered till the time the baby's head is delivered, there should be only 90 seconds gap. So if there is more than 1 or 1.5 minutes between the delivery of the trunk and the head, you have to intervene fast because otherwise the baby will aspirate the meconium or the amniotic fluid. So if the nape of the neck is not visible, means head has not been flexed, in that case we do MSV technique. In MSP, what we do is with your left hand, with both the fingers, you catch hold of the malar prominences and you flex the baby's head. With the other hand, 3 fingers, the index finger and the ring finger will be in the shoulder and the middle finger will push the occiput. Okay, so you push the occiput and pull the malar eminence so that the head will be flexed. So when the head is flexed, it will come down and the nape of the neck is visible. After that, you can deliver the head by steady traction. And the third is your forceps delivery. You can conduct the delivery with Piper's forceps. Piper forceps is a specific type of forceps for after coming head of breech, whereby it has a long handle. So you kneel down by the mother's side and you place the forceps in such a way that your assistant first pulls the baby's trunk. You insert the left blade followed by the right blade and then lock it, and the baby will rest above the handle of the forceps, and then you can give traction downwards followed by upwards so that you can deliver the fetal.